Hard to believe, but kids will be headed back to school in a few weeks. It's important, though, to start preparing now for a healthy school year. To talk about that with us is Dr. Bowa with Cone Health LeBauer Healthcare at Stony Creek. Lots of families, doctor, are still on that summer sleep schedule. When should they start transitioning kids to the school sleep schedule?
Yeah, really good question. First of all, thanks for having me. So I definitely recommend starting 2 weeks before school starts, right? Because it takes time to get back into that sleep routine. And really, what you want to do is shift the bedtime 15 minutes earlier and also shift the wake up time earlier by 15 minutes. And you want to do this every few days,
I can hear the
right?
kids complaining now, saying it's still
Yeah,
summer. How do you get them to go along with this?
Yeah, I would say you want to pair it with a good bedtime routine as well, because that kind of helps them get into it easier. So, all the things that you would typically do as part of your bedtime routine, washing your face, brushing your teeth, but you can put in an enjoyable, calming activity as well to make that more enjoyable, like having a warm glass of milk or reading their favorite book. Right?
Some good advice there. What happens if you don't do this and you try to cram that all in the last couple of days of summer?
Yeah, yeah. Doing it last minute, it's more likely that you're probably not going to be able to establish that routine in time. And what's very likely to happen is that you'll end up starting the school year with poor sleep, right? And that, of course, can lead to trouble concentrating in class, trouble completing your tasks in class. Poor sleep can also worsen any anxiety that you might already have or any stress, and that can directly impact grades as well.
Do different kids' ages need different amounts of sleep?
Yes, I would definitely say there's a little bit of a difference, right, between your grade school kids and adolescents. So I would say kids about 5 to 12 years old, you really want to try to get more sleep, anywhere from like 9 to 12 hours of sleep. And then for teenagers, 8 to 10 hours of sleep is good. And honestly, if kids are napping frequently during the day, that can indicate that they're probably not getting enough sleep. Either that or there may be like a sleep disorder going on, and most high school kids, generally speaking, don't get enough sleep, so 8 to 10 hours is important.
Are there any other warning signs that kids are not getting enough sleep?
Yes, I would definitely say some signs of poor quality sleep can be, like I mentioned before, worsening of anxiety and stress, right? Any behavioral problems can be made worse by poor sleep, right? Trouble concentrating, focusing, trouble completing tasks, right? Things like that. And irritability as well.
So we've got the sleep covered. Another big thing to get ready for school is all those shots that kids have to get. What do you do if you're not sure, you can't remember what they've had, what they haven't? Who do you contact?
Yeah, your first point of contact should be your child's doctor, right? You want to make sure you're getting them in for that well child check, because at that visit, your doctor will review vaccinations and will see what they're due for and what they need. So that's the first point of contact. But the North Carolina Division of Public Health does have a website that lists all of the vaccinations for kids K through 12. So you can look on there as well and kind of see what the school will require.
What's the problem if they get behind on those immunizations? Why are they so important?
Yeah. Um, Honestly, the first thing to think about is that it does have the potential to affect school attendance. So, the state of North Carolina does have a 30-day grace period from the start of school enrollment to allow children to get caught up on their shots. And you don't have to have necessarily completed everything you're due for, but you need to be on some kind of catch up schedule during that period if you are behind. That's the first thing. And the second thing would be outbreaks, right? It's not uncommon for diseases that used to be rare back in the day to make a resurgence. And we're seeing that now with the recent measles outbreak, right? So children who are behind on vaccinations or have delayed them would be at risk of getting sick during outbreaks like that.
Ever since COVID, there's been a lot of people that have had some hesitancy about vaccines. What would you
Mhm.
tell those parents?
Well, I think the first thing, I definitely want to validate concerns, right? It's absolutely normal to have concerns about side effects, right? Any kind of medical intervention like vaccines can have side effects. So that's totally understandable. I like to make sure that, parents are aware of what side effects are more common and the fact that, more rare side effects are just that, quite rare. And so common side effects typically are well tolerated, right? And that would be pain, redness, or bruising or swelling at the site of the vaccine, right? And occasionally you may see some children not feel very well that day after they've had their shots, but rest and some Tylenol typically does alleviate that. And so that can be comforting for parents to kind of get a better picture of what to expect and what's common.
That's why it's important to have a trusted doctor like you that they can talk with. Thank you so much. Stick with us. We're going to have more on the other side of this break about how to handle all that back to school stress with your kids.